This is task 15. We're going to be doing a physical exam on a canine patient. So the first thing you want to do when you walk into a room is just observe the patient from a distance, down. So there's a lot you can gauge with just looking at them from a distance as far as maybe temperament. Do they look fearful, anxious? Are they cowering in the corner? Or are they rolling over on their back and seem very submissive, and this patient would most likely let me pet her. Another thing that you can look at is mental status. So you can kind of see, you know, if they're running into walls or just don't seem to be, they can't really focus on you. You can look at their appearance. For her hair coat looks nice and shiny and clean. Some patients will have oily hair coat or a really dry, dandruff looking hair coat. You also can observe their gait and make sure they're not lame in any places when they're walking around the exam room. Come here. So you just want to, come here. You just want to look and make sure that they're not holding any of their legs up. You can look for knuckling underneath of their feet. That could indicate that they have a spinal issue or neurologic issue. And then also you can look at their body condition. So for her, she is, you can see, pleasantly plump. I'd probably put her without touching and feeling her ribs. She doesn't really have a waistline, so maybe at a 7 or an 8. And that's just without touching her. So we would definitely recommend a diet for this baby. So after that, we're going to go ahead and get her weight. Come here, sweetie. Let's go see how much you weigh. Come on. Off the wind. Come here. So she weighs 36.5. So I'm going to write that in her chart. Alright. So the next thing we're going to do is I'm going to put her up on the exam table. Hi, sweetie. Come here. She just wants to roll over on the floor. And then we're going to have someone restrain her. And you just want to put her head to me. So we're going to look at her perfusion indicators. So I'm just going to lift her lip up just slightly. We can see that her gums are nice and pink and they are moist, which is good. You can look at, just press on her mucous membranes and release, and that should be less than 2 seconds. Also, you want to make sure you're not pulling too tight right here. It looks nice and pale, which you don't want. So just lightly holding the lip up and pressing down and making sure it's only under 2 seconds, and hers was like 1, so that's normal. The next thing we're going to do is listen to her heart and get her heart rate. Alright, so that was 26 and that was 15 seconds. So I would multiply to get my beats per minute, the 15 seconds times 4. So for 15 seconds it was 26 times 4 would be 104. So her heart rate is 104 beats per minute. So the next thing we're going to do is we're going to use our stethoscope again. We want to check her pulse. So what we're going to do is listen to her heart, and for every heartbeat I should feel her femoral pulse. And they're in sync, so that is normal. And the next thing we're going to do is respiration rate. So for her, she's panting. Hold on, sweetie. She's panting, so we would definitely let the doctor know, but just for the sake of making sure we know how to do it, I'm going to count each one. It's okay. That was about 15, so that would be 60 respiration, and I would definitely tell the doctor that she was panting. After that, after we get her respiration, we're going to go ahead and get her temperature. So Daniel's going to restrain her to her temperature. And while you're doing these things, especially before the doctor gets here to do his exam, you just want to use the least amount of restraint as possible to keep you and the animal safe, to make sure that we're not getting them too worked up. So we're just going to lube the tip of the thermometer. And she doesn't have a tail, so we have to find it. I know. Okay, and her temperature is 102.9, which is normal. You know, 99.5 to 102.5 is typically normal for a dog, and she's very anxious, so a little bit higher on the temperature is not concerning at all. So now that I have all of those things, I'm going to record them in her chart. And that is it. Now we're going to start our examination. I'm going to be doing the head to toe examination. So for this patient, we're going to start, I'm going to go ahead and start with her eyes. So we can look in there, or do we see any breaks in the epithelium that you can visualize just with the naked eye? Are we seeing any discharge coming from her eyes? We don't see any of that. Is there any redness to her eyes? So I don't really see any other than what's happening just because she's here at the vet's office. And it's making her a little stressed. Are you seeing any cloudiness with the eyes that could indicate that there could be some age-related change? We also want to check and make sure that there is a pupillary response. So what we're going to do is just hold her eyelids open. We're going to put this light into her pupil and see if it constricts, which it should. You can see there that it is constricting. Do that one more time. Good girl. And it does. So we're going to do that with the other eye as well. Yep. So those pupils are constricting when light is put on them. Alright, so the next thing we can look at on the face is going to be her nose. So you can see that her nose is nice and it's not too dry, it doesn't have any scabs or flakes on it. You can look and see, I can feel the air coming out of her nose. You can also, if you wanted to be more specific, use a microscope slide to make sure that you get the kind of steam coming on that slide. You can also look for any discharge in the nose. You definitely don't want to see any green or yellowish discharge. She has no discharge at all. The next thing we can look at is the oral cavity. So we're just going to go ahead and gently lift the lips. I'm looking for tartar, which she does have a little bit of tartar, more so on her O8s right here. So same thing on this other side, she's got a good amount of tartar on her O8s. I'm seeing a little bit of slight red line, indicating that there is some gingivitis starting up. I want to look and make sure she doesn't have any supernumerary teeth. You know, she doesn't have rows of teeth. You'll see that a lot in our brachycephalic dogs. But she looks to have pretty good teeth. I'm not seeing any fractures. I'm not seeing any loose teeth, which is good. Another thing that you can indicate when looking in the mouth is her mucous membranes. They're nice, moist, and pink, which is great. If they were any other color, such as pale, that would be abnormal. You know, if they were yellow, that could mean that the patient's icteric. You would want to definitely look into the liver. So you can see a lot with just the mouth. We don't also want to open the mouth and look at the tongue. I don't see any lesions or abnormalities on the tongue there. And then I want to look further back in there to the tonsils. Good girl. You just want to make sure that those are not swollen or too red, or there's no ulcerations back there either. So after that, we're going to go ahead and just take a look at the ears. So you want to look at the pinnas themselves, which is the ear flaps. We're looking to see if they're, and that's not yellow skin, it's just her fur. We're looking to see here, is there any redness? Is there any discharge that I can see, which I don't see any with just looking on the outside of the pinna. Same thing here. We can also look to see if there's hair down in there. Sometimes with some breeds, they'll have a lot of hair in their ears, and that could just build up, let debris build up and cause infections. So the outside of her ears, from what I can see, look really, really good. So I'm going to go ahead and take my otoscope and look deeper into her ear so I can see her tympanic membrane. So these babies have kind of an L-shaped canal. So you kind of have to go down and then to the side a little bit. So the tympanic membrane is kind of like a clear, thin filament. And I can see it clearly here. She has no debris and her ear canals are not red. So I'm just going to do the same thing on the right ear. I'm not seeing any debris. And that tympanic membrane looks nice and intact. It's kind of shiny. All right. So after that, I'm just going to, last thing on the head, I just want to feel her her mandibular lymph nodes, I'm sorry. So I'm just gonna feel right under the mandible. Make sure that they're not enlarged. And I do not feel any enlarged lymph nodes here, so we are good. The next thing we're gonna go to is we're gonna go ahead and look at the neck. So we're gonna check her cervical spine. So I'm just gonna palpate on her spinal vertebra. And we're looking for any pain or resistance here. And she is not giving us any pain response. So that's good. Then we're gonna go ahead and palpate her trachea lightly. So I just wanna gently palpate her trachea, see if she gives us any coughs. That could mean that she has some tracheal irritation or maybe a collapsing trachea. And I don't see her cough or anything like that, and her trachea feels just fine. The next thing, we just want to also look at her prescapular lymph nodes. So I'm just going to find her scapula there and feel here. Just feeling for any of those enlarged lymph nodes. Very good. And I'm not feeling anything there either. Okay, so the next thing we're going to do is go ahead towards her back. So I'm going to just kind of run my hands through her fur, looking for any ectoparasites, any skin lesions under the fur, any dandruff. She does have maybe a little bit of dandruff, nothing too severe or to be concerned about. I'm not seeing any parasites, any fleas or ticks. They usually like to hang out at the base of the tail, so you just want to definitely check there really good. We're also going to check her spine for pain as well. So we're going to go, we did her cervical, so we're going to do her thoracic to her sacrum. So just gently pressing, firmly pressing on these vertebrae, making sure that everything feels normal and that she isn't giving us any pain response. I'm not seeing any yet. Okay, so now that we did that, we didn't get any pain response, we're going to go ahead and auscultate her thorax. So we'll go ahead and start with her heart. We want to check and make sure that there aren't any heart murmurs, any arrhythmias, anything like that. Sometimes it helps to hold the patient's mouth if they're panting really hard. Thank you. In doing this, you definitely want to make sure you're doing both sides of the chest. Okay, so her heart sounds just fine. I didn't hear any murmurs. If I did hear a murmur, I would definitely want to notate the point of maximum intensity, but she doesn't have that. So the next thing we're going to do with her thorax is we're going to go ahead and listen to her lung sounds. So on her right lung, there are 4 different lobes. It's the caudal, cranial, accessory, and the middle lobe. And then her left lung, she's just got her cranial and caudal lobe. So we're going to go ahead and listen to all parts. When you're doing this, you just want to make sure you're not hearing any crackles, wheezes, anything like that. All that sounds good. Didn't hear any crackles or wheezes. Also, if you're not hearing anything, that's an issue as well. That could mean that there could be some fluid in their lungs. Maybe the lung isn't expanding like it should. So absent lung sounds are not good. So we did the thorax. The next thing we're going to do is just palpate the abdomen. So we're just going to feel for, our organs that we definitely want to feel and make sure that aren't enlarged, like the liver, kidneys, and those types of things. You can also feel the bladder too. Make sure that that isn't too large. That's definitely something you want to look at for cats that could possibly be blocked or something like that. You definitely don't want to press too hard on their bladders. So I can feel her intestine. She has to go to the bathroom soon. I can feel her colon, and her kidneys. It's harder when the patient is a little bit thicker, because you have to really get in there, and sometimes you aren't able to feel things that you should. So I can feel her kidneys. They feel normal. And while I'm doing this, I'm also feeling, do I feel anything super hard that could possibly be a mass? Definitely don't want to mistake that with an intestinal mass with a piece of hard poop, but you do want to feel and notate anything abnormal that you do feel. Okay. So I don't feel anything abnormal in her abdomen. The next thing I'm going to do is her external genitalia. So in this case, she is, we're going to inspect her perineum. I know. So her anus looks just fine. Also something that she's got a little bit of debris around it, but that is not abnormal. You can also kind of just touch beside, I would recommend wearing gloves if you're gonna do that, but touch beside the anus and make sure that, you know, the anal glands aren't too full. If they're really, really full, you'll see them kind of protruding out. That can be a dangerous thing if they can actually, what am I trying to say? They can rupture, yes. So they look normal. I also want to check her vulva and make sure that looks normal. With a dog, in her signalement, it does say that she's spayed, so we should not see any blood from her vulva. If I did, I would definitely recommend a urinary urinalysis. So her vulva looks normal. It's not red. There's not any discharge. It's not swollen. And this is another thing too with, you know, dogs that are a little bit more chubbier. Sometimes they can get infected, you know, the vulvar opening can get infected, and that can be really painful, but it looks like she's not messing with it, and it doesn't look too red. So after we've done that, we just want to go ahead and check her forelimbs and her hind limbs. We're going to be looking for range of motion. You know, we can check her joints to make sure we don't feel any crepitus. Another thing we're going to do is look at the nails, the pads of the feet, make sure nothing's broken. The pads don't look like they have any. A lot of times you'll see keratinization of the pads, and it just starts growing and growing, so you can always note that. So for her feet, her pads look normal. Her nails look just fine. If they were super, super long, we would recommend to cut them, because that can cause torn nails and arthritis in their feet. So here I'm just going to go ahead and do a little range of, if you want to turn this way. Yeah, perfect. Thank you. I know. So I'm going to extend the foot back. I'm not feeling any crunchiness, which we would call crepitus. And she can fully extend her feet, so that's perfect. A lot of times in our older patients, we'll do this little knuckling thing where it's slippery on this thing, so this is a perfectly normal response. That could mean there could be some spinal issues, neurologic issues. We're gonna do the same thing with like you want to make these movements nice and slow. Also, you know, dogs are gonna naturally pull away from you, but if you have to kind of see whether that is pain response or just a response like, hey, you don't stop touching me. Do the same thing here with her feet. She doesn't want to stand up. Okay. So now we're gonna do her forearms, forelimbs. Yeah. She doesn't want to stand. So we're just going to reach out here. So she has full range of motion there. Also going to check these feet, pads and nails. Perfect. Just turn her one more time. Good girl. I'm not getting any resistance. Checking these pads and these toes. So I'm not seeing anything there. Also, another set of lymph nodes we want to check are the popliteal lymph nodes, if you want to turn that to me. Those live back here. And these ones are usually super easy to feel. Kind of feel like a little BB. Hers are a little harder to find, but I do feel them. They don't feel enlarged, which is great. Perfect. So those are normal. And that concludes our exam. Now that we have concluded our exam, we just need to write in the patient's chart here all of the exam findings that we found, and that is it. Now that we have concluded our exam, we just need to write in the patient's chart here all of the exam findings that we found.